Good morning again. This is Dr. Garias. This is Anatomy and Physiology 1. And this is a quick overview. By all means, no substitute for the lecture and for your reading. But at least you'll get some idea what some of the notes mean, since we missed this lecture, I believe, week 3, week 4, something like that. This is chapter 21, and it's on page 808 of your textbook. And we're going to discuss the lymphatic and immune systems. And I also have a couple of pages of notes on this topic as well. Now, the lymphatic system is a system of tubing and other accessory organs all along your body. And also, they run through the same pathways as your arteries and veins. Now, they're colored, in real life they're not green, but for convention, they're colored, the lymphatic system is colored green upon diagrams and drawings in anatomical science. So let's look at what are the functions of lymphatic vessels. And a lymphatic vessel is what? These tubing. And then you have here also these lymph nodes. They're concentrations or little way stations all along this pathway. Okay, and we'll also talk about the clinical importance and relevance of that as well. Well, if you look in the notes, there are 3 functions: fluid recovery, immunity, and lipid absorption. Sounds like a beautiful, all of the above question. So what do we mean by fluid recovery? Let's look at figure 21.3 alpha. Why do I want to look at 21.3? Well, here's my notes. Tell me I do. So 21.2, 21.4. So 21.3 is on like page 811. So this is 21.3 alpha, right here. If you look here, this is a venule, or very small vein. This is an arteriole, very small artery. And these are the capillaries, is where the veins and arteries meet, and this is where there's gas exchange. Well, there's also a lot of tissue fluid all in between here. And we sometimes lose some of that fluid, and we got to grab some of that fluid back up. So one of the functions of this green here, your lymphatic system, is to get some of that fluid back. If you don't get that fluid back, then you have swelling and edema. This is an extreme form right here on the picture on the right in figure 21.2. Again, we're on page 811. That is elephantiasis. This is when the lymphatic system goes all wrong. So another thing that it can also do is also lipid absorption. It also, within the capillary system, also reabsorbs excess fat. Now let's go back to this picture and let's talk about its immune function. Now when the doctor, goes in your armpit or, starts touching you, feeling you here and in your groin area, it's because that if you have cancer, if you have a disease state or infection, of course, who are we going to call upon to defend our body? We're going to call upon the white blood cells. Well, guess who helps us in that matter? The lymphatic vessels. And what happens to a military base in times of war? Well, the same thing happened. It gets all filled up with soldiers. Who are our soldiers in the immune system is our white blood cells and also our lymphatic tissue. So the lymphatic fluid and lymphatic tissue will get what? Will start filling up these lymph nodes, and then the lymph nodes will get large and at times will get painful. For example, you have a sore throat, you're coming down with a cold, you'll start noticing that your cervical lymph nodes, or the lymph nodes, and your tonsils, your palatine tonsils, will start becoming tender and they'll start becoming swollen. Okay? Thoracic duct and your cisterna chyli, this is a major portion here, your thoracic cavity of a collection of lymph. And you have here, this is called the rachitic chain, right here, because someone thought that it resembled a rosary. And of course your inguinals here. Not too much really responsible for this picture, but this picture illustrates how your lymphatic system works alongside your circulatory system. Now, on item number 2 in my notes, there are certain lymphatic cells. Okay? One of them is NK cells, or natural killer cells. They are lymphocytes. They are white blood cells that destroy anything that's foreign or pathogenic. Pathogenic items are things that will create disease. Patho means disease, gen means the creation of. You have T cells, maybe you've heard of T cells, and they're from the thymus, right here. And T cells, they are very important in AIDS, HIV. B lymphocytes, they are derived from bone marrow. So remember, we had bone marrow, we had yellow marrow and red marrow. That was from the previous chapter, I believe. Did you have bone? Well, you know that, well now that looking at that picture, even if you didn't have that lecture yet, bone is hollow, and there's marrow, and there's a material inside the little nooks and crannies of your bone. And one of their functions is to create blood. So B lymphocytes are derived from bone marrow, hence the word B lymphocyte. T lymphocytes are derived from the thymus. Last but not least, macrophages. Macrophages are large phagocytic cells. Phagocytosis is the function of where the cell eats the foreign object, virus, bacteria, and whatnot. Lymph nodes, we looked at that. These are all the lymph nodes. Their function is to clean and filter all the fluid that runs through here. Because remember, this fluid is doing what? It's reabsorbing some of the excess fluid from the circulatory system, and it's also dealing with a lot of these little mini infections all over your body. So something's got to clean it, something's got to filter it. And also, something has to have all these lymphatic cells ready and waiting for the next battle or the next infection. Lymphadenopathies are when these lymph nodes get swollen. Other organ systems are kind of important, like tonsils. They're part of the lymphatic system. Your spleen is also part of the lymphatic system. It's located in your left hypochondriac region. So if you can kind of imagine this is your ribs here, and of course my patient's left, and it's located right there. The spleen has red pulp and white pulp, and the red pulp obviously is for red blood cells. The white pulp is for white blood cells and macrophages. Now the immune system has certain lines of defense, and the first line of defense, of course, is easy. It's your skin. You have an intact skin, it should protect you from most bacteria, foreign body, and viruses. The problem becomes is when the skin is broken, like in a wound or a cut, or my personal favorite, surgery. Surgery is very, very important. It fixes a lot of things, but surgery also, by the very fact that I'm opening you up, say I'm doing an appendectomy, I open you up. Now I'm opening your first line of defense, and that makes it kind of on the dangerous side. There's no such thing as routine surgery. There's no such thing as easy surgery. The second, another first line of defense is your mucous membranes. And the easiest way to say that is all the stickiness that's inside your mouth, inside your nose, and the lungs. Mucus serves a purpose. Boogers serve a purpose. They're sticky, it's wet, and so what it will do, it'll trap all the foreign body going through your nose, going through your mouth. The cerumen or wax in your ears will also do the same thing, because you want to try to keep this stuff outside of the internal workings of your body. And of course, the second line, and again, your skin and your mucous membranes are non-specific protection. It's just overall generalized protection. Now, the second line of defense, which is also non-specific, are all your leukocytes. your white blood cells. Your macrophages, we mentioned them before. Macro meaning large, phage meaning eat. So these are large white blood cells that will do what? They eat stuff. What do they eat? Foreign body, viruses, bacteria, anything that's potentially pathogenic or that can create disease within your body. Immunoglobulins, immune proteins. Globulin means protein. Inflammation itself. You know when things get swollen? Let's go over quickly the 5 cardinal signs and symptoms of inflammation. So think of the bug bite. When you have a bug bite, there's redness. There's a little bit of heat in the area. And that's not tumor, that's tumor. You spelled it wrong. Swelling, tumor, and dolor is of course pain. And loss of function. Because within that area, we have to, especially if there's an infection, right? We want to shut down the works for a little while so the body can deal with the infection. So for example, there's going to be redness because a lot of blood is going to go to that area. The red blood cells is going to bring energy, it's going to bring oxygen to the area, and the white blood cells are going to bring what? All the immune defenses. Heat. Of course, your blood is warm. Another thing that the warmth does is it provides a really poor environment for the bacteria or viruses or whatever to grow. Swelling. You want tissue swelling with you want the tissues to get swollen up so that, let's say it's poison or whatnot, you want to keep the poison, the bacteria, the viruses contained. So that area will swell up with tissue fluid. And of course pain. Pain is very important. You'll learn in anatomy and physiology too that pain is extremely important. It tells your body what's up. It tells your body that please concentrate on this area, there's something wrong. And again, like what I mentioned earlier, functiolesa, which is loss of function. That area of the inflammation has to be shut down, hopefully temporarily, so that the rest of the immune system can do its job, which is this part. Now those are signs of inflammation or infection, and they're non-specific. They can happen anywhere and everywhere. So let's now, and of course what I mentioned regarding the heat, fever goes into that category as well. Okay? So now that we had a little review of the 5 cardinal signs and symptoms of inflammation, which you will also be responsible for, and remember, they are non-specific. So let's now talk about the specific lines of defense. So you had the first line, which was your mucous membrane, your skin. The second line, which were the leukocytes, macrophages, immunoglobulins, inflammation, and fever. The second line was also non-specific. Now, let's talk about the third line of defense. There are forms of specific immunity. Okay? Now, specific immunity, and we're looking at item 6 in the notes. Specific immunity has these terms like specificity. Specific immunity, that means the immune system will attack something specific. It will attack a specific virus. It will attack a specific foreign body. And it also must have memory. The immune system remembers chemically what the foreign body looked like. So that's why we have vaccines, because you kind of get introduced to what the disease looks like. So if the patient sees the real disease, guess what? The immune system will be specific and it will attack it quickly. And that's the advantage of having that characteristic of memory, that the immune system can remember it. And if they can remember it, they can attack it much, much quicker. Now, what are the types of immunity? We have natural, and this is item number 7 in your notes. We have natural active, artificial active, natural passive, and artificial passive. The best way to look at this is, if it's natural, it happens in real life. It happens naturally, without any chemicals, without any interference from the doctor or the medical staff. So natural active, what happens? You got sick, you got well, and then after you got well, your body formed antibodies so it can remember that virus, remember that sickness, so that when you get it again, it can attack it a little bit better. Natural passive, that's when the patient didn't do anything. For an example is babies. Babies who breastfeed from mommy, they get antibodies from mommy. The baby didn't have to do anything. All the baby had to do is drink the breast milk. And then the baby then got the immunity. So that's natural passive. Now, artificial are human-made things. So artificial active, that's what? That's a vaccine. I gave you a vaccine, your body actively formed antibodies, and that's that. Artificial passive, some examples of that are snakebite antivenom, tetanus boosters, and rabies shots. Okay? Those are passive because my patient didn't do anything, because we're doing stuff. We're doing stuff temporarily. It's a temporary immunity. It's just for that moment. So, for example, if you haven't had a tetanus shot in a while, what must we give you? Tetanus booster. The only time we give you a snake bite antivenom is when what? You got bitten by a snake. The only time you get a rabies shot is when what? We're suspected that the dog or raccoon or whatever animal that bit you potentially has rabies. Again, it's a temporary immunity. It's only for the now. But these are artificial because they're human-made. Okay? That's a beautiful question. The question that always gets it's challenging. Antibody versus antigen. We already discussed that in our laboratory sessions. We discussed that in earlier in this particular video. Let us now go to cellular immunity versus humoral immunity, and that's item 9 in your notes. And let's go to figure 21.22, and let's see what page is that on. And you can see here again. Here's some examples where how the lymphatic system is intimate with your circulatory system. And in many textbooks, the lymphatic system and the circulatory system are talked about in the same chapter. Here's another example here. Here's your venous system. It matches up with lymphatic and with your lymphatic thoracic duct. Duct means just tubing. Where is that chart? 21. I really should put down page numbers. Okay. Don't need to know this unless you want to go to medical school or be an immunologist. That's the complement system. I'm going to talk a little bit about that in a moment. Inflammation we already talked about. Agents of inflammation, don't need to know that. 2119. We talked about general, let's talk about specific. Where is it? Getting close, 21.20. Okay, here you go. Cellular immunity. Okay. Cellular immunity here, and you can see it deals with T cells. You have T cytotoxic, T helper, T regulatory, and memory T cells. Where's the chart? Somewhere. Here you go. So this is cellular immunity. And let's explain what this is. First of all, you need an antigen-presenting cell. Antigen recognition. And remember what antigen was? It was the jacket. So bacteria, they have a certain jacket. Viruses have a certain, well, not viruses, but foreign body, fungus, all the things that could be potentially pathogenic or disease-producing has a jacket. Well, guess what? Because in cellular immunity, you need a antigen-presenting cell. And in this particular case, it's a macrophage. It's a way that the macrophage grabs onto the bad thing and goes, hey, this is bad, let's go kill it. All right? Who else is part of this antigen recognition? Your T cytotoxic and your T helper cell. Then there's something called co-stimulation. So the very fact that the antigen-presenting cell is present, right? It goes, and the T cytotoxic cell, T helper cell, guess what it's going to make? It's going to make more T cytotoxic and T helper cells. So now you could see how in cellular immunity gets affected in AIDS or HIV. If you don't have these T cells, if your T cell count is in the basement, then nothing will do what? You won't have any antigen recognition. That means you won't be able to identify the bad guys. There will not be co-stimulation and clonal selection, meaning to say is there won't be, there's nothing to stimulate, there's nothing to call the rest of the troops. So I could ask you, what are the three parts of cellular immunity? Antigen recognition, co-stimulation, and clonal selection. And then, of course, they make more. You know, when you make a clone of something, you're making copies. Because if there's one bad guy, there's going to be other bad guys. So you call upon the troops. I'm going to need more troops, either T cytotoxic or T helper. And antigen recognition requires what? An APC, an antigen-presenting cell. And in this particular case, this is a large cell. It's a macrophage. Okay. Now let's go to humoral immunity. Now the word humoral doesn't mean funny in medicine. Humoral means means liquid. Okay. That's really specific. Now, if you go here on page 838, figure 21.25. See if I can fit this all in one screen. I guess not. All right, let's talk about this. Just like the cellular immunity, humoral immunity also has antigen presentation. Okay? But this time it's the B cells. And on the B cells, do you see they have what's on the coating of all these B cells? You have these receptors. Receptors are like little seeds. So if they see antigen, antigen sits on these little receptor seeds, and then guess what? It gets activated. And when it gets activated, right, it goes, T helper can come by, but the difference is, in their clonal selection, instead of calling upon more T cells, guess what it does? It has something called differentiation. It creates plasma cells, and it creates antibodies. So think B cells, antibodies. And along with that, it creates more memory B cells. So B cells are memory cells. They remember stuff. And how do they remember? They remember through these receptors. So the antigen, so this is very different. Doesn't really need doesn't need the macrophage to go tell them what's going on. Because it needs these memory cells, and that's a B cell. And once once the B cell gets activated, and then there's a clonal selection and then differentiation, guess what? Now I have a whole bunch of antibodies. It creates antibodies. So these plasma cells create antibodies that will now specifically attack those antigens. So what kind of questions could I ask regarding the difference between cellular and humoral immunity? Which one's B cells? Which one's T cells? Which one's memory? Which one requires an APC or an antigen presenting cell? What is a good example of an antigen presenting cell? Macrophage. And these two systems, are they specific or non-specific? And as you can see here, they're highly specific. All right, and that is the immune system in a nutshell. Okay? Good luck. See you on Monday.